Hi, my name is Heather Ramos, and I'll be performing the dressing change using a sterile technique. I am in my Nightingale uniform with my badge, and I have my supplies here, my hand sanitizer, clean pair of gloves, my sterile kit, my wound with my old dressing change, and my bio bag. I'm going to introduce myself to the patient and then explain the procedure. Knock, knock. Door. Close the door for patient privacy. Perform hand hygiene. Hi, my name is Heather, and I'm going to be your nurse today. Can I please see your wristband? Thank you. And can you tell me your first name, last name, and your date of birth? Thank you so much. Okay, so we're going to be cleaning your wound today. I'm going to be taking off the old dressing and putting on a new dressing. And I'm going to be doing this using a sterile technique. So a couple things to note with that. Please don't touch the wound when I'm cleaning, and please don't hover over my supplies, and because that could break the sterile field and we'll have to start all over again. Okay? Do you have any questions? Awesome. And are you in a comfortable position? Great. Let's begin. Okay, so I'm gonna sterilize my hands again, or hand sanitize my hands. Hand sanitize my hands. Okay, and then put on gloves. All right. So when you remove the old dressing, you're going to remove it in the direction of the hair. You're also going to remove it parallel to the wound. This doesn't have a lot of stick on it anymore, but toss. Okay. Now we can visualize and see the wound. I'm going to palpate and look for any signs of infection, any drainage, tenderness to the touch, warmth to the touch, any odor. None of that is observed. Great, that's a good thing. Okay, so we're going to remove our gloves and we're going to begin the sterile procedure. Toss. I'm going to remove my badge first and set it aside because I don't want to risk breaking sterile field and having my badge accidentally touch my gloves or one of the sterile objects. Okay, now we're going to open up the kit. There's a 1-inch border that you can touch. Make sure it's laying flat. Pinch to get the gloves out. Okay. I'm going to turn to the side. Lay it flat. Now using my non-dominant hand, I'm going to pinch the outer cuff like so and put my hand in. Good. Now I take this hand and use these fingers and go underneath the cuff and put my hand in and ensure that it's tight. Good. Okay. Now that I'm over the wound here, I have my sterile hand and my dirty hand. So sterile hand's going to go into the kit and grab the ChloraPrep swab and then drop it into your dirty hand. There's 2 levers on the side of the ChloraPrep swab that you would click and snap. It would allow the cleaning solution to go into the sponge. And once you do that, then you clean the wound from the inside out. So you want to go around, nice one clean swipe. I would toss this and then I would grab another one. I only have one. So you work your way out. Okay, toss. Clean hand. 2x2, drop it. And then dab again, working from the inside out. Discard. Drop it. outer area now? Scarred? Okay, so we can reassess the wound at this point. Again, looking for any signs of infection, palpate around any odor, any drainage. None of that is observed. Good. And at this point, you can measure the wound if indicated, but in this scenario, it's not. And I will grab my Tegaderm out of the package. It doesn't have much stick to it anymore. But at this point, you use both of your hands and then you peel away the backing and then you can discard that. Okay. So with this, you're going to lay it down, starting the center and then fold it out and then press it down. There is a white tape around the film. And in the real world, you would just peel that up and then it would lay down flat completely. Okay, we're done here. I'm going to go ahead and throw away the packaging. And now we take off the sterile gloves and then toss. All right, I'm going to go ahead and use a Sharpie and initial, date, and time that we do the procedure. Not a real Sharpie. Initial, today's date, and the time. Okay, we are all done. Are you in a comfortable position? Good. And how are you feeling? Are you in any pain? Awesome. All right, so the call light is right next to you. You just press that button and one of us will come and check on you. Okay, let me go ahead and grab my badge. Put that back on. I'm going to perform hand hygiene one more time before I exit. Okay. And then exit. Okay, I'm out of the patient's room. So what I would do is go in the patient's chart and document the procedure, my findings, and the results. Okay. Thank you.